Texas is doing considerably fewer COVID-19 tests than it should to make a dent in this pandemic. That's according to research done by scientists at Harvard. They created maps showing how much progress has been made. Anastasia Bolton talked to one of the authors of the study about the state of COVID-19 in Texas.
The goal is to ultimately control a pandemic.
Numbers and math, they can be scary, confusing, and sometimes, frankly, meaningless. Like, how does all this actually impact your life? Houston area native Dr. Tom Tsai is part of the team at the Harvard Global Health Institute, working on putting together publicly available COVID information in here's where we need to be to get this over with format.
We created a dashboard and created different thresholds based off of what we call mitigation or suppression.
Mitigation is slowing the spread of COVID-19. Suppression is controlling the pandemic.
A suppression level of testing really lets you get a comprehensive understanding of the true prevalence of COVID-19 in the community. More importantly, it's enough capacity to allow for a strategy to fight the pandemic.
As of Friday, according to Harvard's math, Texas is performing about 156 tests per 100,000 people.
But in order to truly suppress the current COVID-19 pandemic in Texas, it may need to test 10 times that number because of the escalating number of cases that we're seeing.
If you feel you've heard this before, it's because you have.
Part of the challenge in testing in the U.S. is a lack of capacity. I feel like it's deja vu. We're repeating the conversations that we had in March. The way to rescue the economy is to beat the pandemic so we can ultimately return to life as normal pre-COVID-19. And that means developing the testing capacity, supporting contact tracing, but also ensuring that there is a consistent public health messaging from the state level on wearing masks and following the guidelines that we know that work.
I'm Anastasia Bolton.
We have asked the State Health Department to comment on Harvard's assessment of our testing. We also asked if the state has its own targets on how much we need to test to fight this pandemic. So far, we have not heard back.